I'm going to show you just a couple of minutes of a recent talk by Russell Barkley, neuropsychologist we were talking about earlier, presenting some of the information that I think is critically important for us to understand, and he says it's so much better than I could. Let me show you this.
We need to understand that in the case of ADHD, the origin of these deficits is largely neurological and genetic, not social, not a choice, not due to video games or TV or your diet. So we have the most striking neurogenetic disorder in psychiatry in ADHD. What does that mean? It means that if you have a biological disorder, it is completely humane and rational to use psychopharmacology to compensate for that disorder. It is like insulin to a diabetic. Indeed, I tell patients ADHD is the diabetes of psychiatry because it brings to mind the treatment model that you have to have in place in order to deal with this disorder. But it also speaks to the need, often, for neurochemical alterations of the brain to help manage that disorder. We can now refer to ADHD medications as neurogenetic therapies. That is not hypothetical. We have a very good idea where they work in the brain, the alterations they make. We are even learning the genes and their polymorphisms that are building and operating these networks and how the drugs alter them. Perhaps someday in the near future, we will simply do genetic testing in the office to tell us which drug is best for your kind of ADHD. So this is a neurogenetic disorder. Neurogenetic therapies are completely rational and humane to be used with these individuals. Now, one thing I do want to point out, one of the greatest discoveries of the last 5 years in ADHD research, which you will never hear in the New York Times because it is so biased against psychopharmacology for children. We now have 29 studies that show that the longer you stay on your medication, the more normal your brain becomes. So that children who take medication have brain development and brain functioning much closer to normal individuals than people who never take medication. By the way, this is only children. There are no studies of it, and I'm not sure that it would work in adults anyway because the brain is a lot less plastic. But notice, by using these medications to keep these executive networks functioning at a higher level, you may start to see neuronal sprouting and brain growth in the areas that are crucial to executive function. This is known as neuroprotection, and just last week, a meta-analysis of all of these studies was published arguing that we have evidence that ADHD medications may well partially normalize brain development. And you won't hear that